Ladies and gentlemen, at 2 p.m., Dr. Pavel Anders will present a seminar on well-rooted ST&PT. Please join us.
Okay.
Hello, everyone. Thank you for joining us today. It's a great pleasure to introduce Dr. Pavel Anders, a highly experienced professional. Please give him a warm welcome.
Thank you. Thank you. My name is Pavel Anders. I'm practicing dentist. I come to you from beautiful city Szczecin in Poland. I work as a part-time job in Medical University of Szczecin, and maybe some of you I know they were in our beautiful city. All others are welcome. I would like to share with you today my fascination with bioceramic materials, and I started using bioceramic materials. What's bioceramic? Yes. All of us know what's MTA, Portland cement, yes? And all of us know disadvantages of Portland cement, of classical MTA, yes? How difficult is handling. Sometimes we have difficulties to get it set properly, yes? Also, all of these materials are so-called hydraulic cements, yes? So it means they require water to set, yes? And Welded PT, welded ST, so VERICOM materials, are so-called bioceramics. So we may say it's kind of artificial, man-made MTA, yes? Without all its disadvantages. So not staining teeth because it's white. We don't have to mix it because it's pre-mixed, yes? And also it's very active and ready to place. So pre-mixed materials. We all know we have all these guidelines, we have these different associations who give us procedures, papers, lectures. This is an article that I'm co-author about pulp capping using bioceramic materials. We have different things. I would like, during this lecture, to share with you simple methods to save teeth from endo treatment. How many endodontists are here? Okay, so sorry about this. There will be part about root canal sealer, yes? But most of the lecture will be about pulp capping, saving teeth with deep caries, yes? So these things that we general dentists trying to avoid endodontic procedures, which also is not 100% predictable, yes? Also, in some cases, it's much better to save the tooth alive. So, we have our magical potions, yes? And our magical potion is Welded PT, so putty type, and Welded ST, syringe type, so root canal sealer. I start with Welded PT, so it's in a small compules, like singles of composite, pre-mixed material, no need to mix it with water. It's white, it will harden just with pressure of moisture in the cavity, yes? And this is beautiful material, I like it so much. After many years of looking for material ideal in my hands, this is what I found, yes? So this is why we're meeting here. And bioceramics, Welded PT is material which is pre-mixed, ready to use, and just water, the moisture which is in the cavity or root canal is enough to set. We don't have to put this cotton pellet with water like with NTA. We don't have to mix it, yes? It's just ready to use. So this case is a young friend of mine. And these pictures are not from my dental office. His was treated by some other dentist because I was always where I'm not trying to pull patients from another dentist. If somebody has his dentist, okay, even we know each other. But he said one day he's calling me, Dr. Pavel, I have a problem because I went to dentist. He knows a little bit about dentistry, and he was aware that dentist was doing him very deep caries cavity. And in one moment, dentist said, oh, we have pulp exposure, yes? And he was aware that enough aware person, even not being dentist, that we have tools to save, yes? And he said, do you have bioceramics in dental office? And he said, yes. Normally I would do endo treatment with this pulp exposure. Caries is deep. These are pictures I got from the patient when he asked the pictures from dental office. Yes? And with such a deep caries, the dentist said, okay, so if you wish, okay, I know you, okay, I put you bioceramic. And dentist put some other bioceramic materials, doesn't matter the brand at the moment, but the problem was that this bioceramic materials was treated at temporary filling as well, yes? And after a few days, we have winter, this young guy had problem because the material partially fall out, yes? And patients start feeling pain of breathing even, yes, with cold air, yes? He told me, oh, maybe it's still there. And this is the picture he just made with normal mirror, yes, small mirror, like for checking teeth. And it's still there a little bit, yes. Go to this dentist, please say that you need some additional filling. He put glass ionomer, he said. This bioceramic material fall out, and I saw it after 2 weeks of working with this bioceramic material that the no bleeding, maybe starting formation of dental bridge, yes. And I decided just to clean cavity with sodium hypochlorite and place well-root PT, then place base material. In this case, I used light cure base material and final filling with composite, yes? And this is the result. Patient is happy. Now it's 1 month after this treatment, and I just before coming here, I made a control in dental office. This tooth is still alive, yes. We checked with cold, we checked with pulp tester, yes, everything is fine. So it's just a case. So we have deep caries, we have very deep caries. Few years before, we would make endo treatment 100%, almost 100% in this case. Right now, we have our magical potions to save the teeth. And first situation is pulp exposure, yes? So for some reason we have pulp exposure and how to use well-root PT. We have to stop bleeding and we disinfect the cavity plus stopping bleeding at the same time. We're using sodium hypochlorite. Then we're placing well-root PT, yes? And then glass ionomer could be VERICOM glass ionomer or any glass ionomer or any even light cure base material. Why it's so important to put some base material here? Because well-root PT is highly alkalic, yes? This is how it works, yes? It is creation of hydroxyapatite. Also, this kind of bioceramic materials like well-root PT, they also work with inflammation factor in the pulp, yes? So it's not only creation of hydroxyapatite, it's not only being alkalic, but it's far beyond, yes? And final filling. So it's similar case to what I shown with this young patient, yes? But with well-root PT that do not require any time of waiting before placing base material on it, yes? We can leave let the patient go within next few minutes with final filling, yes? With permanent filling. This is something that's completely changing our procedures. This is a picture from my friend Dr. Łukasz Połudzin from my city. You see pulp exposure, then hemostasis, well-root PT, and beauty of well-root PT is nice consistency. You will see it now in the movie. Then during hands-on you can look that this is almost like temporary filling consistency. Very nice, very easy to place. Then glass ionomer and final and permanent filling. Another case from my colleague who is big fan of lasers, Dr. Maksymilian Kaczewik from Poland. He had pulp exposure and first he put laser, yes, Erbiak laser, and then sodium hypochlorite, well-root PT, glass ionomer, and filling. And what's nice in this case, we have here is immediately post-op, yes, and here we have 14 months later, you see this part? This is dentin bridge. So this is something what we would like to achieve, yes? What's also important with well-root PT is that we can precisely place it where we want and put final permanent filling. So also the cavity is sealed, yes, which is also very important for us for success in these procedures. So this dentin bridge and post-op, yes, and this is 14 months later. So material itself is in a compules, yes, like singles of composite. So normal gun is enough, and I just want to show you the nice consistency, how we can control the material, yes? Of course, it's not only for pulp capping, you can also use it for retrograde filling, so apitectomy. You can use it for also in root canals when there's very wide open apex, yes, and we need so-called apical plug, yes. This is material of choice, yes. You see how nice it works? You will see it in your own hands after the lecture. Another situation, so-called, is this new nomenclature of the new procedures regarding how deep is caries, because now we can treat it something that few years ago would be even treated as doing something against the procedures, yes? Now we can leave caries in the bottom of cavity, yes? You see? This is something when we see demineralized dentin, yes? No, and we can put sodium hypochlorite, well-root PT, base material, and permanent filling, yes? This demineralized dentin normally would be shown with a caries finder as demineralized, yes? When we scrub it with Explorer, it's scrubbing like demineralized dentin, but we can leave it. And this many appointment procedures, yes? Another situation, caries is reaching the pulp, yes? This thing we see on X-ray, right? Sometimes, and in this case, normally it would be, okay, this patient is for endo, yes? Let's schedule for endo, even it's no pain, yes? It's too deep. With contemporary procedures, yes, and endodontic associations, this is so-called very deep caries, yes? And in this case, of course, we have to clean the walls of the cavity very precisely, carefully to the white sound dentin, yes, of course, enamel. And we leave this caries dentin, yes, this very brownish caries dentin, yes, layer on the bottom of the cavity, yes, and we leave it, yes. Placing sodium hypochlorite, doesn't matter what percentage, well-root PT, and glass ionomer as temporary restoration, but this kind of temporary restoration that will put it for 1 year, yes, and in most cases, if there will be no pain symbols, inflammation symbols, pulpitis symptoms, this dentin with action of bioceramic material like well-root PT will harden, yes? So after 1 year, we're removing this temporary glass ionomer, we're removing well-root PT, cleaning the cavity. I'm a big fan of air abrasion, salt blasting, aluminum oxide courses also for primary teeth, yes? However, it's primary teeth, pulpotomy, of course, it's a procedure that requires very good cooperation of our young patient, yes? I may say you something completely off the record. Yes, can I? Yes. I can share with you something that I hope nobody will kill me, kill us, yes? But let's come back to this, yes? And let's imagine this is primary tooth, okay? Officially, at the moment, in the books, we have to make pulpotomy in this case, right? Unofficially, I can share with you what friend of mine who are pedodontists, I cannot tell you names because I don't want to put them to the doctor's court, yes? They doing, sometimes we have some friends, some, close children, yes? And they just don't want to make pulpotomy. So they doing exactly the same thing, cleaning the walls of primary tooth, leaving this caries dentin, yes? Putting well-root PT, yes? And glass ionomer as final filling or even composite, yes? And believe me, at the moment when we're talking with each other, like 80% of these teeth reacting the same way like permanent teeth, so the tooth is saved without pulpotomy, and normally after a period of time, roots are being resorbed, yes, and the tooth is falling out. So it works, yes? So much easier procedure than making pulpotomy or, of course, extraction, yes? And many professors say that maybe it's just not enough time, yes? And this kind of caries dentin capping, maybe in 5 years, maybe in 10 years, these bioceramic materials, because of ease of use, like welded PT, will be changing the books, yes? The same like with this caries dentin capping in permanent teeth, yes? So the procedure will be adapted to. This is what we think will happen, yes? Unofficially, it works, yes? This is the tooth, the picture of the tooth that I got from my friend from my city, pedodontist. So this was pulpotomy. Here is welded PT, and everything around was nicely resolved as primary tooth should be, and it fall out, and this is how it works. Well done, pulpotomy, yes? Also, when we have injuries, yes, welded PT, because of ease of use, is material of choice for saving pulp in injured teeth in children cases. Welded PT as a putty type material is also excellent material for apitectomy, so retrograde filling. Yes, in the situation when we have to cut the apex of the root. Yes, and retrograde filled with welded PT. What's important? Friend of mine, my boss, I may say in the department, Professor Lipski, made a test with specimens, and he put other bioceramic material, and here in case of welded PT, so it stays where it should be, which means it's very ergonomic for apectomy. Plus this excellent consistency that you will try in a minute. This is case from my friend Dr. Przemysław Stankowski from Poland, and this you see open chamber of apitectomy. Here is the cut tip of the root, yes, and here is welded PT. And my colleague said that he hated for many years. He does a lot of surgery. He's a big opinion leader in Poland, and he does from time to time apitectomy. And he says he hates apitectomy unless I give him shared with him samples of welded PT and said, Paweł, I loved apitectomies again. Yes, this is marvelous. It works. Yes. So this is another ST, yes, that causing discolorization. So this is zombie tooth, yes. The case showing revascularization, revitalization, and also apexification, yes. And here we see the non-vital tooth with not finished root formation, the apex formation. And in this case, this tool will be never vital again. It will be semi-vital, so this is why I call it zombie tooth, yes? And the procedure, just making long story short, is we have to disinfect the canal with antibiotic, put calcium hydroxide for a period of time, yes, to disinfect the canal, antibiotic, clean everything, and then dentist, through this open root canal apex, very wide apex, is scrubbing the bone and bleeding, causing bleeding, yes? And then here is coagulate performed, yes? And on this coagulum, a dentist is placing welded PT, so bioceramic materials, to promote blood vessels grown to this coagulum, yes? It will be never pulp, normal pulp. The tissue is called so-called like pulp tissue, yes? The tooth will be never as vital as other teeth with normal pulp, but enough vital as a zombie tooth, yes, to create apex after certain months, yes? So beautiful use of welded PT to create this bioceramic plaque here to promote vascularization. Yes, beautiful case from Professor Lipski from Szczecin. So this was part about patty type well-root PT in compules, yes. And now it comes to, I may say, sister or brother material, yes. Well-root ST, which is something that we were always dreaming of, predictable, easy to use, not discoloring, root canal sealer, yes? And the well-root ST is in a syringe, it's pre-mixed, it doesn't require any special procedures, it's very easy because it's single gutta percha cone, and that's it. So let me share with you how to use it. This movie I made few days ago with my daughter, yes? She was playing dentist with me, and we have syringe of well-root ST. Here is plastic cannula, yes? And it has additional measurements so we can, without placing endostopper, easy find how deep we are in the root canal. We need gutta percha point, and we need instrument with endostopper, yes? So first we have to establish the full working length, yes, and we're placing endostopper. Then we unscrewing the syringe and placing the cannula. What I will also do, I'm always checking if the flow is correct from the cannula, just in case, yes, to avoid any nervous situation in the patient mouth, yes? And then cannulas are easy to bend. They're not losing the light, yes? And we're placing the material. It doesn't have to be working length. It should be half or 2/3 of the root canal, yes? And then with this instrument to the full working length, we're spreading the material in the root canal. And then we have to place gutta percha, and papers saying that the best is always if gutta percha point is covered with the material. And my trick for this, my tip for you is to unscrew this cannula, place gutta percha in the cannula, which already is, anyway, it goes to the garbage, yes? And it's nicely easy to spread over the cannula. This is a little bit. So this procedure, how to easy, predictable, and see very fast, place root canal sealer to the canal, it could be a little bit different what company shows in the instruction. However, this procedure we're teaching in University of Szczecin. This is procedure that Professor Lipski says is the most accurate according to the most contemporary books and papers. Very predictable, easy. And this is case from Dr. Michał Kowalik, just with these little puffs. It will really overfill with around above the apex the material. The beauty of this material is there's no pain usually. Yes, it's much less pain than with especially with resin sealers. Another case, easy of use, and this is the case where doctor has resorption here, and in this case we use both. We use patty type. He used the Centrix applicators to put this apical plug, yes, in the root canal, and then sealing with root canal sealer. Okay? So well-root PT and well-root ST in the canals. Well-root PT, well-root ST are not novelty on the market, because we dentists are always afraid if something is so-called novelty, maybe it's not properly tested yet, maybe in 2 years it will disappear from the market because of I don't know what, yes? So this material is made by VERICOM, very reliable Korean company, and they produce also other materials, but this material, especially well-root PT, is absolutely unique on the market because of properties. And we have many papers starting, I think, 2000 first. It's like more than 10 years at the moment, yes, with researches on the materials and being published, yes. So we are safe. Another case from Dr. Michał Kowalik, also with apical plug. And in the end, I'm not so sophisticated endodontist, yes, so I'm sharing some sophisticated cases. I was asking him because you see, this is root canal filling made approaching from the buccal surface of the tooth to save sound occlusal surface. Yes, I asked him. I'm asking him, is it a kind of ninja access? No, it's not ninja access because it's open wide, and it's just something unusual to show you. Yes, and this bendable cannula, plastic cannula, is very easy to place in this difficult case. So once again, thank you. I hope if you will try, I know VERICOM has for you samples of them, both of well-root PT putty type and well-root ST syringe type root canal sealer, and I hope you will love the material like me. Thank you very much. And I will show. Let me show you the material, how it works at the booth. Thank you very much. Any questions?
For how long do you keep the bleach on the treated area to disinfect?
Just few seconds, half a minute, something like this.
Okay.
Yes, and you don't have to rinse it.
Don't rinse?
You don't have to rinse it.
Just blow?
Just blow, you dry, and place well-root PT. Yes,
Okay.
in most cases. And only in case of perforation, I didn't cover in this presentation perforations. Well-root PT, of course, as you can imagine, is also perfect material for perforation. And in this case, sodium hypochlorite shouldn't be so strong, yes? But in all other cases I've shown, doesn't matter what percentage. It could be even very strong percentage.
Okay, after the glass ionomer, you say you like to use sandblasting.
Yes.
Can you do the sandblasting after you put the glass ionomer to do the final restoration?
Yes, you can. You can sandblast if it's always after placing base materials. Yes, I'm always sandblasting the cavity before placing bonding system. In reality, me personally, I do not use gas ionomer unless it's a case with leaving patients for 1 year. Yes, but even in this case, it's usually I use light cure base material to cover well-root PT. And what's beauty in this material, I can really immediately after placing well-root PT, without any cotton pellets, without anything, I can immediately put base material to prepare cavity for bonding.
And use it also with the adhesive?
You cannot use adhesive immediately on the well-root PT because it's highly alkalic, and our bonding systems or etchant are highly acidic, so it would blown almost, yes? So we have to use this mesh material only to cover this highly alkalic well-root PT from bonding system, yes? Let me remind you once again. Wait. Yes?
But after the glass ionomer, can you use the adhesive or not?
Just use your bonding system normally after gas ionomer, yes? Just fill the cavity, yes? It's just base material. Is it clear? Yes? Yeah.
Thank you.
Thank you. Any other questions? Okay, let's play. Dziękuję.
We also prepared some samples of well-root PT and ST. You can also take it.
Just give them some.